The agenda this week checked in on Omicron, QAnon, and to begin our week in review, the return to online learning this week.
We entered this pandemic in a time of relative peace. We're not in civil conflict. We don't have civil war. We are relatively peaceful. We have one of the largest bureaucracies comparatively in the world. And what that means is we have an administrative structure that is well developed. It is really difficult to understand how, when we have those conditions, we are now in the third year of academic disruption without a plan. It's one thing to say, oh, we didn't really see it coming in March of 2020, although people who study pandemics and global health would have said that actually we should have been more prepared. Well, fine, let's say that that was the case. We're now in January 22. We have access to a host of other technologies that just weren't available: vaccines, rapid tests. I mean, in theory, they're all there, and we have within our country the systems to be able to plan. So what we end up seeing is this ad hoc policy on the fly for education, in Ontario in particular. This province has the largest cohort of elementary and secondary school students, and yet we've had the longest school closures. And we don't start at zero. We start at 26 because we've already had 26 weeks of school closures since March of 2020, compared to Quebec, for example, which had 10 or 11 weeks. And so when now we have an extra 2 weeks, you need to understand that those closures, the effects of those closures are cumulative. So we have to start at 28 weeks. Every time there is an extended closure, we have to add it on to the to the existing closures that were already there.
Prachi, you mentioned curriculum. We're going to come back to that in a few moments. But Annie, Prachi said this was a predictable outcome and it could have been prevented. And even with the 2 weeks that we've been given, a lot of people are asking questions. What's going to be done in those 2 weeks to make schools safer for teachers, for students, for everybody? In your view, what should the government have done that they didn't do in order to keep schools open?
Well, and I think it's not just safer, right? Yes, safer, but also with all of the appropriate supports in terms of ensuring that kids are able to recover and, thrive and move forward. And I think that Prachi brings up an incredibly important point about the lack of planning. It's been kind of extraordinary that there's been no plan. So even in the press conference, with the premier, when they announced that schools would be closed for another 2 weeks, all of the media said, so what are you going to do in those 2 weeks to make sure schools can open permanently? And there was actually no answer. So I run a nonprofit. In nonprofits, you're accountable and you have to have goals. And some people say you have to have goals they call SMART goals, which stands for specific, measurable, attainable, relevant, and time-based. And so we are looking for, and we've made recommendations to the province for setting those goals and being accountable for those goals so that when schools reopen, we have prioritized booster shots for all of the education staff. We've got vaccination centers in schools, so we're getting all of the 5 to 11-year-olds vaccinated we possibly can, because that rate's really low right now. It's like, let's use this time to get the N95 masks, to distribute the funding that was promised last spring, which has still not been distributed at schools. We're in the middle of surveying all the principals in Ontario, and they are writing us the saddest, sort of most pleading kind of messages, saying people need to understand what we're trying to do here. They're commending their staff, but they're really, really worried. They're worried about the well-being of their students, and they're worried that they too, just like us, are hearing what's going to happen next in the media. So they have no time to prepare, they have no time to think it through, and they're not being consulted with. So one of our other things we've been saying for, I don't know, it feels like forever now, is that there should be an education advisory task force. Why aren't we listening to people like Prachi, to principals, councils, the directors of education, teachers, parents, students, together with health experts in health, so that they're all working together to use evidence, expertise, and their experience on the ground to give good advice to the province. And right now, it does feel like, that is the part that's upsetting, is the lack of planning, short or long term. And it feels like it's driven by politics or by, one person phoning the premier or, everybody arguing about what's the, kind of least worst choice or most palatable choice. But we're not thinking, I don't think, about kids and about their future and really understanding the deep impact of this.
The problem is we're anticipating so many infections is that even a small proportion of hospitalizations into a small proportion of a large number still translates to a lot of hospitalizations. Now, there is a lot of reassurance in the fact that there are some pretty good data that there is vaccine effectiveness against, especially with the third dose, against hospitalization. So getting the booster or the third dose can reduce the severity. So when we think about severity, we often think about hospitalization, critical illness, and death. So that can be reduced substantially. Numbers are a little bit variable, but somewhere in the realm of 75 to even up to 88% in one UK study. So that's really reassuring. And part of that, even though there is less neutralizing or lower concentrations of neutralizing antibodies, that's just one arm of the immune system. So there's another arm called cellular immunity. And it does look like there's some data in the last week, 2 weeks, everything's coming out so quickly now, that shows that T-cell immunity is still pretty robust. So that potentially may be why we're seeing less severity. There's also a study from Europe that shows that it can, even though I agree with Dr. Morris that, this is not, vaccination does not confer sterilizing immunity. There's always a chance that you will transmit, but the reduction in household transmissions is substantial enough that it could play in a really important part in at least blunting some of the transmission, especially with close contacts, such as households.
And let me do this follow-up with you. Is it still the case, as it was with previous variants, that there is a disproportionate number of people in hospital and in intensive care units who have yet to be vaccinated? Is that true?
That is correct. So unvaccinated or partially vaccinated. And one thing we need to bear in mind is that our definition of fully vaccinated is also going to change. And I think we're more likely to adopt terminology going forward, maybe calling, for example, third doses updated vaccines, because I don't think we're done yet. I think we need to prepare ourselves and socialize the idea that ongoing vaccination will be a reality here. And as many people know, some of the vaccine manufacturers are looking at developing and have already developed and are testing Omicron specific vaccines. We just don't quite know yet what the triggers will be to roll those out. I think we have a lot of work to do in that regard.
Robert, let me circle back to you. And again, I want to go back to the education angle here, because it was only last Thursday that the medical officer of health for the province of Ontario took to the microphones and said, we may need to start the school year a couple of days late, but basically it's all systems go and you're not going to have to put your kids through online learning again. It was only 4 days later that they completely changed their position on this and said, okay, things have changed. 2 weeks now, we need a real circuit breaker here. Can you get us inside that cabinet room and tell us what obviously transpired on Sunday evening when they were having their meeting that resulted in such a different position emerging from that meeting than from the week before?
Steve, I think what happened on the Sunday is that the Premier was shown some new modeling, and I would take all of the modeling with a grain of salt, just because the best indicator of future behavior is past behavior. And we know that the modeling projections dating back to April 2020 have always been so wide ranging that we don't really know. Are there going to be 10 cases today? Are there going to be 10,000 cases today? At a certain point, it becomes really, really difficult to figure it out. But anyway, I gather that he was shown these projections that 1% of Omicron patients could end up in hospitals, and that as Dr. Mubaraka was saying, it would swamp even 1%, a huge number would be very, very difficult for the health system to cope with. Now, I don't know where that 1% number came from as we do this taping, Steve. I'm trying to find out. But I haven't seen that in any of the studies that we've looked at from Europe and South Africa. So I don't know if it's 1% or if it's 0.1%, but whatever. He was worried enough that he went to the cabinet and said, "Look, this is what's going to happen, and we have to close schools." But the problem with closing schools is there's a cascading effect that comes from that for childcare, for the kids themselves, because I think the mental health of our children is the thing that I'm worried about as a parent. What's it gonna be like for them after the pandemic? I mean, how are they going to cope? Online learning, and teachers and students and school boards have done a great job coping, I think, but it's not the same as an in-classroom, in-person experience that we all enjoyed when we were in school. And I think that's something that we really need to worry about. And I know that the Tories are very worried about the political ramifications, because parents are upset about this. They're upset that they got told one thing on Thursday, and then the following Monday they got told the complete opposite. And now when they say, "Oh, it's going to be January 17th that schools might reopen," I don't think anyone believes that that's going to happen. Because Omicron numbers are still going to be going up, presumably. I mean, Dr. Moore suggested that yesterday that it would hopefully taper off by the end of January, which would be fantastic if that's the case. But that doesn't mean schools are reopening on January 17th if it's still rising, you would think.
Well, let me go to Dr. Morris on that. Obviously, the Premier of Ontario is making decisions along with his cabinet based on the modeling numbers that he's getting from his public health experts. I guess the question I have for you is, how much faith should we have in those modeling numbers upon which these important decisions are being made?
It's a great question. I think modeling at this point in time is very difficult. Even at the best of times, with the best of information that we have, it's very difficult. But the difference that we have in this situation is we are facing Omicron for the first time in, I guess, the planet's history at the same time as other jurisdictions have. Previously, we were learning from other jurisdictions. So we're learning in real time the behavior of Omicron in a manner that we didn't face, for example, with the first wave or really any of the other waves, including Delta. So whether it's 1%, 0.1%, more or less, these are clearly going to be just guesstimates.
One of the most interesting things I learned from your book is that there's an assumption that QAnon supporters must be overwhelmingly uneducated, overwhelmingly rural, overwhelmingly out of touch with reality. But in fact, your book paints a very different kind of a picture of who's in QAnon. You want to help us with that?
This perhaps was one of the things that were surprising, but Sophia and I have both studied terrorist organizations, between the two of us probably for 50 years. And so I guess I should have known better. I think part of what I was thinking is you had sort of this poor white uneducated class. Remember, President Trump once said, "I love the uneducated," because of course the uneducated voted for him. One of the things that became clear is that a lot of women in particular who believed in QAnon were women who were successful. They were business owners. One woman even had a master's degree from Harvard University. And so this is really not sort of the stereotypical, low-hanging fruit. And again, you can make a similarity to many of the terrorist groups, that it wasn't only uneducated ex-convicts who joined ISIS. You had people who were doctors or lawyers or engineers. And so I think that it's important that we understand that, first of all, there's no profile for a terrorist, and there's no one profile for someone who believes in QAnon. But there isn't even a political profile, because when the Washington Post last year, around the time of the insurrection or the failed insurrection, did a survey, what they found was 6% of people who believe that there is a blood-drinking cabal run by Democrats and Hollywood elites trying to undermine Trump, 6% of those people that said yes identified as Democrats. So we may even see that there are people who are not just Republicans that support this idea, although it is sort of an uneven, it's disproportionate. It's probably around 30 to 33% of Republicans also subscribe to many of the most insane ideas of QAnon.
And why would it appeal, in your view, to so many women?
I think that QAnon was very capable, whoever was running this, and Jim Swartzen, for example, thinks it's a psychological operation. They were very adept at making people, and particularly women, feel that this was the only way that they could save the children. So in 2020, there was a hashtag campaign, hashtag Save the Children, that was on Facebook, Twitter, and Instagram. And what this did was it pulled in a lot of women. And the question that QAnon was asking is, do you want to save the children? And the answer for most women is always going to be yes. But remember, Steve, I also study ISIS. And that is exactly the way that ISIS appealed to women. Did you want to save the orphans in Syria? So I think what this does is it appeals to women on a very basic level, but it also pulls people in, not because you're some white racist, I hate the Jews, I hate people of color, and so you join QAnon. It's bringing in people who think that they're coming from a place of altruism. I actually joined QAnon and fell down the rabbit hole because I was trying to help people. I really was worried about trafficking. I couldn't believe what was going on with Weinstein and Epstein and Woody Allen and all these horrible people in Hollywood. And so they take a tiny grain of truth, which is what's going to pull in an educated person. But then once you get pulled down the rabbit hole, the consumption of the QAnon material and the propaganda has this effect of convincing you that it's worse than you ever thought, that the conspiracy runs deeper than you ever believed. And so because I'm on their channels and I'm on Telegram monitoring what they say, I see what they see. And you know what? It's really traumatizing. It creates an echo chamber of radicalization that we've seen with jihadi groups and we've seen with racist white nationalist groups.
And that's just some of what we covered this week on The Agenda. For more, including the full conversations, you can visit our website, tvo.org, our YouTube channel at youtube.com/theagenda, or our Twitter feed, twitter.com/theagenda.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.